Joining us now, Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control at the University of Kansas Health System. Good morning to you and welcome. How important is it that everyone get on the same page when it comes to fighting this measles outbreak?
Oh, I think it's very important. In the medical and public health community, we know that there is the overwhelming consensus about what it takes to stop this or decrease this outbreak. And it is simple. It is that very safe, very effective vaccine.
How much protection does the vaccine offer?
Oh, certainly. The vaccine offers an immense amount of protection, 93% after that first dose, so protection against disease and the complications. After the second dose, up to 97% or more protection against the disease and complications. Again, a decades-long track record of safety and efficacy about protecting against the complications of this disease.
As I mentioned, most of the cases now spreading are within the unvaccinated community, but there are some vaccinated cases. How likely are you to get it, and do the symptoms and the treatment, are they different if you're vaccinated?
Yeah, no, I think that's a great question. So we certainly know there can be some breakthrough, and in this case, breakthrough after vaccine. There can be cases of people who've been vaccinated and do have some symptoms of the disease, but those symptoms are immensely less than if you are unvaccinated, and the chance of complications are extremely less, and then also your ability to spread it is less as well. So we know that the vaccine will help with that overall, but I think we need to understand that, just as you said, it continues to be a disease of the unvaccinated, and with that, we understand the vaccine rates in the United States, which are significantly lower than they were 5 or 10 years ago. So all of those people who are unvaccinated, who are unprotected, are going to be at risk of getting the disease.
Dr. Hawkinson, how does the measles spread?
So measles is the airborne spreader. It is unfortunate, but when somebody has this disease and they are spreading the disease, you can spread it from 4 days before the rash occurs until 4 days afterward. If they walk through someplace like a clinic or a store or a church or an airport, that virus can linger in the air for up to 2 hours. People then can inhale it even an hour later and become infected with it. So it is one of the most infectious viruses that we have encountered as humans.
So what is happening in communities, big and small, across the country to combat this, to educate the public, and what should folks watching do to best protect themselves?
Yeah, it's hard to know exactly what every community is doing. Certainly, we know in Kansas here and in southwest Kansas, where we have had cases, there is a public health effort to get out the accurate information, to get vaccinated, understand your vaccine status. Certainly, even us here at the University of Kansas Health System and in our community, we are continuing to endorse understanding your vaccine status and getting vaccinated. And I think even in Texas, there are vaccine clinic or campaigns going on as well. So I think it's important for every community, because we know that overall in the United States, vaccine rates are lower, to understand community vaccination rates, really get out, endorse, as we had talked about. The consensus is to understand and know and endorse the vaccine, because the vaccine will offer protection against the disease, and most importantly, against those complications and especially death. We know we've had 3 deaths so far. It is tragic. It is not just a number. Even 1 death is too many for this disease, because we know we have a very safe, very effective vaccine to stop those types of things.
So this will all be part of the discussion today as the CDC meets. How do you view the CDC's role in this conversation and the weight that any decisions made today or in the days and weeks to come will play in this conversation?
Yeah, I think the role of the CDC, these people who are very educated, very experienced, is to look at all the information, look at the data, draw their conclusions and recommendations from that, and put out the safest recommendations. Again, it is a recommendation body. It is not to mandate or do anything like that. It is to recommend the safest practices for individuals, for communities, for health systems. Put out those recommendations so that we can keep our communities safe. We can keep our families safe, our loved ones, and I think that's what will go on today.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.